Hi, and welcome to the Future of Dermatology Podcast. I'm your host, Dr. Faranak Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Hi, I'm Dr. Faranak Kamangar, board certified dermatologist. I am the founder of Derm GPT, which is what we'll be talking about today. I'm also the department chair at the Palo Alto Medical Foundation, Department of Dermatology, and the chair of the San Francisco Dermatological Society. Today, we're going to be talking about how we can use a language-based model, generative AI, to improve our clinic flow and practice management. A little bit about machine learning and generative AI before we get into Derm GPT specifically. Machine or artificial intelligence is basically teaching a machine or a computer to do what humans can do. That's the basics of it. Machine learning, traditional machine learning, has been usually pretty tedious, very time consuming. A lot of finances were needed to teach a computer to do one task. That was kind of the traditional way that we were doing machine learning. Generative AI, of course, we're all very familiar with it with Chat GPT and OpenAI. Since this technology has become available, it's really sped up how we can make improvements in this field. I would make the comparison that machine learning, I kind of compare it to like if a small child is learning how to speak, if that child was learning how to speak one word at a time, it would basically take forever before they were conversational. Generative AI is kind of more similar to how the human brain works. So a human small child can make inferences and learn lots of things from watching and comparing words, etc., so that at the age of like 2 or 3, a small child can actually have a full conversation with you possibly. So that's a very different type of technology, and it's really democratized how we can use this data and how we can come up with solutions faster than we were able to do in the past. I have a history or a background in engineering, so I've been working in health tech for a very long time, and I'm very excited for the power of what generative AI can do for us in medicine. And within artificial intelligence, I just want to briefly show where we are here. So we're within machine learning, and unsupervised machine learning is the specific category, and then language models. This is different than visual, which are a lot of the other platforms that you might see coming up in dermatology that focus on image-based artificial intelligence. This is very different in that it's language-based, meaning it works with via text. You can ask it prompts, ask it questions, and it'll respond back in text. So the classic examples, of course, of language models are GPT-3, GPT-4 that we're familiar with. GPT-3, they basically took about a quarter of the internet, about 17 gigabytes of data, threw it at the GPT, the responses were pretty good about the things that it was coming up with when you asked it a question. It took the bar exam. GPT-3 took the bar exam that attorneys take and scored in the 10th percentile. GPT-4 has even more data, 45 gigabytes, and it scored in the 90th percentile, which is what we think it would be able to do if we give it more information. There's, of course, new iterations of GPT that are being worked on. Derm GPT, which is what we'll talk about today, has been built on more than 3,000 peer-reviewed articles, text, information from dermatologists. And it's been reviewed by dermatologists, so we know what's in there. And it would be actually fun at some point to see how it does on one of our ABD practice exams. So I won't go into this really busy slide too much, except that I just want to show that on the very top with the blue cloud, that shows the data, the text data from the internet that was put in an unsupervised fashion through GPT. And then you have the outcomes, the green box, you get, your responses. The very bottom where it says your data in the vector base, that's us. So that's what a Derm GPT type of platform does, where we put in our own data. The reason that's important is the output that you get is a little bit more precise and more trustworthy. if you're pulling from just the internet, you can pull anything. The information might come from a random blog. You just can't trust it as much. When it comes for your own data, you know the source it can pull from. So the answer that you get is likely to be what you're looking for. This is just another slide to show that concept. It's going to focus a little bit about more of what we say, like garbage in, garbage out. So basically the data that you put in, the output that you get is only as good as the data that you put in. And if you pull from just random set of data, you can have more errors. There are different types of errors that can happen with AI. You can have logical errors where you basically could ask it like, what's 2 plus 2? And it might tell you 10, which then you know is clearly wrong. But the worst type of error are hallucinations, which sound kind of good. So you might not even be sure if it is wrong or not. So when you're pulling from a random array of data, that's a really high risk. When you're pulling from your own controlled data in a vector base, you can really bypass a lot of that and just have really accurate responses. So that has very high value from a business standpoint and impact on your daily practice if you're going to be using these prompts to make decisions and make your workflow a little bit faster. And of course, everyone, is a little bit maybe mildly afraid of AI taking their jobs, but I like to always say that it's not going to take your job, but people who use Gen I will definitely take your job. They'll just be faster, more efficient than what they do. And then I'm going to go a little bit into Derm GPT now. So Derm GPT, I like to kind of give a little bit of background of health tech in within dermatology. So health tech, starting with health tech, sort of healthcare 1.0, in the 1970s, started with paper charts. So patients, or a lot of physicians being on paper charts in their clinic. We still to this day know a lot of physicians who might be on paper charts, and not because they are not great physicians, but because the technology we have now makes them kind of inefficient. And so they choose the more 1.0 version of technology that was available. We now, about when I would say about there's healthcare 2.0, healthcare 3.0. Healthcare 3.0 was when more around like 2016 or so, when like EMRs, telehealth, these things started being a little more prevalent. And then now we are at health tech 5.0, which is where Derm GPT lives. It's kind of the advent of the newest technology with generative AI. So there's a large spectrum of where our colleagues are along their tech acquisition or uptake of technology into their practices. I would say even our physicians who are on paper charts, most of them have iPhones or Androids. They're not on the 80s flip phones. So they are not innately afraid of technology or opposed to technology. But within the health tech space, technology hasn't worked super well for the physicians so far because it hasn't been created with the physician in mind or with the physicians very involved in the early stages. So Derm GPT is something that we created, and it was very much starting with pain points in clinic and then working backwards. So what solutions can we come up with? And these are, the use cases are kind of endless of what you can use a language model for, but these are classic ones that our colleagues are using Derm GPT for. So one of the top ones are things like prior auth denials, denial letters, coming up with that text to be able to get your patients the medicine that they need. Derm GPT is being used for scientific writing, for medical charting, billing, coding support, clinical inquiries if you're just wondering something and you want to do quick recall. Patient messages is a very helpful area. So if a patient writes a message, you can relay that message through Derm GPT and get an answer that sounds pretty good. So some practices are using it to the point where the medical assistant is getting a prompt and the physician will review the prompt, of course, and make sure it's correct. But then if it looks pretty good, you've changed the task from a physician having to sit there and type out a paragraph to a physician just kind of looking it over and saying, that looks good. You can send it out. Marketing support, patient education handouts, those are all use cases that it's been used for. So basically, people ask, where should you use Derm GPT in your practice? I like to say it's whenever you are approached with kind of a medium to hard task, clinical task. So we're approached with clinical tasks all day. Things are popping up, messages, patient requests, nurses coming up and asking things. In a clinic day, it's pretty, nonstop. And then when we see a mild task, like a really low acuity one, we will just do it. It'll be easy and we do it and we move on. The tasks that in our brain seem a little harder, we put it off till later. But the worst thing you can do is leave things for later, because I have this picture here of an exhausted physician. That's you later. So if you pile on more and more work later, it's just going to end up in a bad, vicious cycle. What you want to do is take that perceived hard task or medium to hard task and make it an easy task. Do it right then and there and be done with it. So to the point where you're not looking at the same message or same clinical task more than once, because even reviewing it is kind of a waste of time. So if you've reviewed something, find a solution to it and move on. And that's where Derm GPT can help. This is the site. It's www.dermgpt.com. You can go in and sign up as a board certified dermatologist. You can ask it anything you want. Like here we asked it, who are you? And it said, I am a dermatology assistant AI. And then you can ask it specific things. So these are just examples we put in, but can you help me write a denial letter to an insurance company for a medication that was denied? That's an easy enough task for it to do. And you can, of course, look through the letter, make sure it sounds pretty good and it's the medicine that you're asking for. And if it looks great, then you send it over to your medical assistant who can fill in some of that information like patient name, medications tried and failed, the specific patient information that your staff can help with, send it off. You're done with that task. Can take about 10 seconds to do. Could be even just simple questions, like you're seeing a patient in clinic, let's say with just even plain acne, but for some reason their acne is not responding or improving the way you thought it would. This might be something that you might turn around to a colleague and ask, hey, what would you do? But what if there's no colleagues around? Derm GPT can kind of fill that role. So you would basically ask it a question of like, what else could this be? And then you might say, oh, I didn't really think about asking if they're using, steroids, for example, just to help you kind of jot the memory. And maybe you're on call, you're seeing a patient with lots of blisters, you do a biopsy, you put a few things on your pathology requisition, but you kind of just can't remember past number 4 or 5 on your differential diagnoses. So quick recall is very helpful. If you want to look up just some information about medication or specific pathophysiology that would take you a little bit of time, you would have to sit and look it up, find the right resource. It's, again, really, really quick recall. Sometimes we're approached with really, really odd tasks, but they have to be done acutely. Like a few weeks ago, my nurse said to me, can you please write me a letter of recommendation? And it was like a Tuesday, and she said, but I need it by Friday. So there are some of these time-sensitive things that come up, and if you add them to the pile of the later time, there is no later time. Just do it now. It can take about 10 seconds, and you're done with it. New medications, if a new medicine is out, sometimes it's hard to keep on top of all the regulations and lab testing you have to do. This is just an example of looking up, okay, I want to prescribe this medicine, but what labs do I need to check? Or maybe an older medicine that you don't prescribe every single day. So you just want to make sure you're not missing any labs. So you would look up what labs should I check for cyclosporin? And there's the normal ones that you know of. And then maybe you forget about magnesium every time and it'll just jot your memory. Patient queries are very helpful. Patients will ask questions in all sorts of formats. So a learned language model that can understand the gist of what the patient is trying to ask and then come up with an educated response to it is incredibly helpful. So this is an example of a medical assistant taking a question like this, asking Derm GPT, coming up with an answer for it. Of course, you always want to get the physician to review it, make sure it's correct. And if you get their approval, then you send it out. There are also citations included in all your answers. So if you're wondering, is this real or not, just open up the citation and read the source article. Patient handouts is another easy one. For example, you're in clinic or maybe you're at a satellite site and you don't have your handouts and you want just a quick thing on tretinoin. It'll come up with this for you in about 10 to 30 seconds as well. So basically the main gist is you want to turn yourself at the end of clinic day from the super exhausted person on the one side to the meditating, happy, done hours earlier physician. And we know from our data, it's been published that about on average, if you're in 8 hours of clinic, 8 hours of patient care, easily up to 5 hours of it in ambulatory care setting, easily up to 5 hours of it can be spent on the electronic medical record. So you can imagine if you can do incremental changes and shave off an hour of two of that time, what else could you do with that time, right? You could just have more time back to yourself. You can see more patients and you would just be a lot happier over time. Lastly, just a quick plug for Derm Pub. This is the Derm GPT Journal of Innovative Dermatology. And this is a pretty cool project that we worked on as we were developing Derm GPT. We realized that the language of our communication is very PDF based. So a lot of our journals are, even if they're HTML, eventually you have to turn into PDF to share in between colleagues. And PDF is not something that generative AI or AI platforms can read very easily. They can do it, but it has to be converted, which takes effort. And the truth is when we submit an article to a publication, it's not in a PDF format. So they're changing it from one format to the PDF, and the PDF in the future, as more things are going to be going towards AI, is not a really helpful format. So DermPub was our journal that we built on a different format. One that AI can pick up very, very easily. I won't get into too much of the nerdy details of that, but we're pretty excited about it. And of course, lots of, tech. Thank you so much. And let me know if you have any questions. This QR code, of course, just takes you to the Derm GPT site.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.